Thank you so much. I'm so pleased to be here today. I'm the acting director for the National Institute of Nursing Research. NINR is one of 27 institutes or centers or offices at the National Institutes of Health. So, let's see. No spoiler alert here, but today I will be making the case for that nursing science and nursing research is essential, as it actually provides the foundation for our clinical practice and also the data that our policy workers need to have in order to affect policy. It assists us in identifying, developing, and testing evaluations of best practices to address the social determinants of health. I will do that by describing the essential role that nursing science fills in addressing social determinants of health and health disparities, beginning with an introduction to NINR and the role of nursing science in healthcare research, followed by some contributions of nursing science to understanding the impact of social determinants of health. I will present some current research funding opportunities and initiatives that reflect NIH and NINR's interests and priorities in research on social determinants of health, including workforce diversity in healthcare research as a driver of health equity. Nursing science fills a critical role in the health research enterprise by bridging gaps between the bench, the clinic, and communities. It translates findings to clinical care with a focus on the needs of the individual patients. Nurse scientists are in pivotal positions in the transformation of healthcare science. They have become essential leaders and participants in cross-disciplinary team science in designing and testing solutions for a broad range of healthcare issues. Those with PhDs have knowledge of research design and methods and can partner with nurses in clinical settings who have other degrees such as DNPs or ANPs. And most importantly, nurses bring a clinical lens to the table when interpreting study findings. This is essential. NINR support enables researchers and investigators in building the scientific foundation for clinical practice, prevention of disease and disability, and the management and elimination of symptoms. NINR provides funding to scientists across the U.S. to conduct research in symptom science, wellness, self-management, and end-of-life and palliative care, and to train the next generation of nurse scientists. Science is the foundation for understanding social determinants of health and advancing evidence-based practice. This area of research is supported across NIH and will continue under the forthcoming NINH Minority Health and Health Disparities Strategic Plan. This plan is ongoing in its development at NIH and hopefully will come out later this fall. And it is a cross-NIH plan. But we also have the National Institute of Minority Health and Health Disparities. It is one of the 27 institutes that we have. This institute leads scientific research to improve minority health and reduce health disparities. We also have the NIH Office of Behavioral and Social Sciences Research, which coordinates behavioral and social science research conducted or supported at the NIH. And it integrates that research within the larger NIH enterprise. A recent trans-NIH effort focused on utilizing social and behavioral measures captured in electronic health records to screen for unmet social needs and referral to targeted interventions to reduce patients' health risk associated with social determinants. Nurses have a strong tradition of patient-focused care and partnering with vulnerable communities to achieve positive health outcomes. Through research to improve knowledge and understand cultural differences, precision interventions have and will continue to be developed to enhance health equities. And I will provide multiple examples of this throughout this presentation. A lack of educational, financial, and social and healthcare resources can have a significant impact on underprivileged racial and ethnic communities. NINR-supported research has shed light on some of these disparities, leading to development of effective interventions. For example, a program that promotes healthy behaviors in low-income settings through positive parenting behavior, and educational interventions that influence behavior change and have led to decreases in HIV and AIDS risk behavior in diverse populations of adolescents. Additional studies have revealed poor quality diets among Latina mothers in association with their children's assimilation to American culture, significantly less healthcare utilization by African Americans in comparison with Caucasian Americans after the 2007 through 9 recession, and significantly lower ratings from families from racial minorities on the experiences of a loved one dying in an intensive care unit. Geography can also affect health across the lifespan through the individual and combined contributions of the local environment, access to health care prevention, and interventions and other factors. NINR-supported research in this area has revealed that the substantial burden of out-of-pocket costs for rural breast cancer survivors, a correlation between regional clusters of lung cancer deaths and higher concentrations of particulate matter population in non-urban and southern parts of the country. Poor health literacy is a significant factor in poorer outcomes in rural heart failure patients, and geographic differences in patterns of end-of-life hospice use. Community engagement is recognized across NIH and in the forthcoming Minority Health and Health Disparities Strategic Plan as a critical tool in the development and translation of strategies to improve public health. Given their unique role as both researchers and trusted clinicians with the most direct contact with patients and their families, nurse scientists are ideally positioned to conduct community-based participatory research. Examples of interventions developed with NINR-supported research and community engagement include health infographics on healthy eating and following healthcare provider instructions on blood pressure, stress, and body weight in a predominantly Latino Dominican population in an urban setting, and health support network for Latino immigrant men from a collaboration of community members, healthcare and social service providers, and researchers to improve social support and healthcare access. This chart depicts the percentage of each NIH institute, center, and office totals fiscal year 2018 budget for funding health disparities research. Because health disparities research includes health outcomes associated with racial, ethnic, and gender minority status, socioeconomic status, and rural communities, this information provides a window into NIH funding for research on social determinants. With 31% of its budget supporting health disparities research, NINR was second only to the National Institute of Minority Health and Health Disparities, indicating robust involvement of nursing science and health disparities research. I don't think anyone in this audience would be surprised in our interest in funding that type of research. Research in the social determinants of health and health disparities will continue to be a focus of NINR. As I've just described, nurse scientists have made important contributions to the field and are poised to continue as important leaders and members of interdisciplinary research teams. Here are some current areas that we are funding, such as community partnerships to advance research, reducing health disparities among minority and underserved children, health promotion among racial and ethnic minority males, strategies to provide culturally tailored palliative and end-of-life care for seriously ill American Indian and Alaskan Native individuals, and end-of-life and palliative care approaches to advance signs and symptoms. NINR has also partnered with other parts of NIH to encourage research, such as disparities in surgical care and outcomes and transgender health. NIH-wide initiatives that target health equity include the All of Us program, an historic effort to gather data from 1 million or more people living in the United States to accelerate research and improve health. The All of Us program is gathering lifestyle data through mobile devices, wearables, and sensors, obtaining behavioral data through questionnaires, and also biobanking biologic samples for future study. Participants are partners in this effort. National enrollment in the All of Us program was launched in May of 2018, so a year ago. After 1 year, I'm pleased to report that more than 230,000 individuals have been recruited, and of those, they've made a significant effort to recruit in a diverse population. So 50% of the enrollees are from racial and ethnic minorities. This is very important for us to actually conduct research within a diverse cohort so we can apply and generalize these findings to the groups that are among us in the United States. We also have the NIH Office of Scientific Workforce Diversity, which focuses on attention on training with the goal to enhance diversity and inclusion throughout the scientific workforce. It uses data-driven approaches, has scientific models, role models, and mentors from diverse groups. And as part of this effort, they have created the NIH Distinguished Scholars Program for hiring and career progression of tenure-track investigators. This, we're pleased to say that we actually have an NINR investigator who competitively entered this program, Dr. Polly Joseph, who is at NIH now with us. And the Scientific Workforce Diversity Group will be actually trying to put some of their methods and put that within the university systems around the country as well. So hopefully within your own schools you'll be learning more about that. So these and other efforts in workforce diversity make a difference in research to understand health disparities. It is important for us to have in our pipeline and as investigators and researchers in our university systems, those who are diverse, so that they can particularly help us recruit diverse participants as well. So the next generation of nurse scientists will continue these efforts. NINR is currently supporting several graduate student research projects, for example, in training in social determinants of health is a focus among several of the organizations participating in the NINR-supported palliative care research cooperative group. So I appreciate the opportunity today to describe for you the importance of nursing science, what the field has accomplished, and the significant role that science, research, and data will play in addressing social determinants of health. Thank you very much.